Hi, good evening, everyone, and welcome to the COVID-19 Community Town Hall for the Upper Peninsula, which is presented by UP Health System Portage. Our virtual broadcast tonight is coming to you from the Michigan Tech University campus. We want to welcome all of our viewers and listeners that are joining us tonight on the Zoom webinar, on Facebook Live, and tuning in on 97.7 The Wolf here in Houghton and Q107 over in Marquette County. It's great to have you with us. Good evening, welcome. My name is Steve Elmer. I'm a college professor and member of the Health Research Institute here. Just a few minutes, I'll be joined shortly by my co-host and colleague, Kelly Kam, an epidemiologist, and the rest of our town hall speaker panel for tonight. We're excited to have you with us. The topic tonight that we'll focus on is maintaining our mental health, our physical health, and our well-being during the COVID-19 pandemic, and looking ahead as we build forward from the pandemic. To do that, we'll bring in a panel of experts to provide information, offer recommendations, and importantly, answer questions that you have here tonight. Just a couple of brief announcements before we get started. I want to recognize our sponsors, which include UP Health System Portage and the Michigan Health Endowment Fund for their support. The Town Hall series is organized by the Health Research Institute. Their mission is to facilitate health-focused research, education and training for our students, and community outreach here in the rural Upper Peninsula. The goal of each town hall is to increase awareness about COVID-19 and how it impacts your health, the health of your family, friends, neighbors, and your community and society as well. All of our town halls are publicly available. They are recorded and archived on our town hall website. That website is mtu.edu/health-research. Once you're on the page, go ahead and click on Town Hall. You can pull up all of our previous recordings. If there's anybody that you know that can't be here tonight, our town hall will be rebroadcasted this Sunday at 12 p.m. Eastern on ABC 10 TV coming up on Sunday. Next, I want to welcome in my colleague, Kelly Kam. Kelly, good to be working with you again tonight. Kelly is an epidemiologist and expert in infectious disease. She's a college professor here at Michigan Tech University. Kelly, this is not our first time doing the town hall. I think tonight's our 25th one since the pandemic has started. So can you tell us a little bit about who's here tonight and what's coming up on our program here?
Absolutely, glad to be here again. So throughout the pandemic, we've been addressing different areas of how the pandemic and the response to the pandemic has affected our health. And within public health, we have kind of what we call the big three, which are three of the behaviors that are really big indicators and really big effects on our health in our communities. And that is physical activity, diet and nutrition, and tobacco. And in addition to that, one of the key things that we really have seen has become a huge problem within the pandemic and really brought attention to that is our mental health and well-being. So we have those four areas that are going to be addressed tonight, and we have 6 different speakers that are going to be addressing that. So from Michigan Tech, we have Crystal McLeod, who's the director for the Center of Student Mental Health and Well-Being, to talk about kind of on the back end. We've been nervous about the risk of being sick, and now as things are starting to change, that anxiety about getting back to normal and what that means. And then we have 3 speakers talking about physical activity. Angela Luskin, who's the manager of our Express Care and Fitness Center here in Houghton for UP Portage. 2 of our graduate students in our department, Kinesiology and Integrative Physiology, Carmen Scarfone and Isaac Lennox, will be speaking about physical activity as well. We have joining us from the state of Michigan, so Michigan Department of Health and Human Services, we have Karen Brown in the Tobacco Control Department, who'll be talking to us about tobacco control and the dependence and how that's been affected by the pandemic. And then even reaching further into another snowy area, we have Maria Aguero, excuse me if I'm pronouncing your last name wrong, she's a clinical dietitian from SUNY Buffalo, who's going to be talking to us about how our diet and nutrition's been affected during this pandemic. So quite a wide variety, and we're excited to have people from across our region here joining us tonight.
Well, certainly looking forward to the town hall tonight, Kelly. And I know just to, as you do always every town hall, just to put things in context, where are we with case trends and hospitalizations, how things are looking here? I know you're going to talk about pandemic to endemic. So I'll turn it back over to you to help us formally get the discussion started here tonight.
Sure. So as many of you have seen in the news, our cases are going down. We had across the country and certainly within our regions, we've had that huge peak of the Omicron cases. We are going down. We're kind of here in the Houghton area. We're kind of close to where we were in the beginning of January. So we're still in high transmission, but definitely on the downswing. It does mean that we can't quite let up just too soon. We don't want to let up too soon on our protections and our mitigation policies that we have in place. We do have the risk of new variants always occurring. They probably will occur, and we never know what's going to happen. So predicting things, as much as us epidemiologists like to predict, it's not a crystal ball, and we really don't know what's quite going to happen. But we do know that vaccines continue to be extremely protective, especially if you've had a booster. And even if you've been infected, you should still get a vaccination to be even further protected. And we are seeing that there's a new variant that seems to be coming out. We don't know quite what's going to happen with that, but people who have been infected with Omicron recently do seem to have some protection, pretty good protection as well, from this new variant showing up. So that's also good for thinking about the future, that immunity that's occurred for people who are unfortunate enough to get infected, as well as our boosters. The other things that we have to really consider within our communities, we know that we're able to kind of target our prevention strategies a little bit better now, and we do really need to think about what our own communities are facing, not only transmission in our own communities, but what do our communities look like? Are we a community that has a lot of elderly people that are high at risk? Do we have a lot of young people who may be at less risk? Do we have good vaccination rates? Here in Houghton County, only about half of our population is vaccinated. Now, again, we do have some immunity on top of that from people who have been infected recently. We also have to consider what our healthcare systems have. So here in rural areas, we don't have the level of healthcare facilities that urban areas do. And so when we have high numbers of hospitalizations, our systems get stressed much faster. So those things all need to be considered, as well as taking care of your own health, which is what everybody's going to be able to speak about tonight.
Thanks, Kelly, for getting us started. A question for you here. We're hearing a lot in the news about going from pandemic to endemic. I'm wondering if you could touch on that a little bit more. What does that mean, and what would that look like, maybe from a national perspective, but also locally here in our Upper Peninsula region?
Sure. So an endemic situation is that there's always going to be kind of some low-lying levels of disease. So if we think of that with other diseases like foodborne diseases, there's always some people who are going to be getting E. coli from food that they're eating or various other sources. And then we see peaks of that happen seasonally. It is expected that we will probably see the same kind of things, although the peaks wouldn't be summer, we'd have probably winter peaks with this. So we're never going to get away from this all the way. We're never going to get down to zero, but hopefully we'll get to a level where we have enough protection within the community. People are able to take precautions themselves to protect themselves. And we get to this low level where it's kind of a risk that we as a society are willing to take and be aware of that. But there may be these levels of peak epidemics that occur within the endemic level of acceptable disease.
Thanks, Kelly. We'll come back to you in a little bit. We're going to go on to our next speaker. I just want to remind folks, if you do have a question, there's two ways to send in a question. You can email it to us at townhall2020@mtu.edu. If you are on the Zoom webinar with us, you can use the Q&A button at the bottom to send in your question, and we'll do our best to direct the questions to the appropriate speakers. Next, it's my pleasure to welcome in Crystal McLeod, who is the interim director here at the Center for Student Mental Health and Wellbeing. I hope I got that right, Crystal. Welcome back. You've been on the town hall before, so we appreciate your time. And I'll turn it over to Crystal, who will talk a little bit more about mental health here.
Hi, Steve. Thank you for inviting me back. Yes, I'd like to focus a bit on the anxiety that some people may experience as mask requirements and use decreases, as gatherings become larger. I've been meeting with quite a few people who have expressed some concerns regarding that adjustment, which makes sense, right? We've all been really limiting our social interactions. We've all been utilizing safety precautions that really do decrease our social interactions and activities. For some people, the prospect of socializing more is exciting. They've been looking forward to it, can't wait to get out there. But for others, it can be pretty anxiety provoking, whether or not you had a pre-existing anxiety disorder before COVID. So I'm going to go through some tips and strategies that might be helpful in terms of decreasing the anxiety and worry, increasing your comfort. One of those being to go at your own pace. You certainly don't need to say yes to everything right away. Building up to more anxiety-provoking situations can be helpful. It may be helpful to construct a hierarchy of those situations and then Start with those situations that may provoke some anxiety if you were to attend an event, but maybe more manageable there. And take those opportunities to say yes to those situations and then work your way up. It's just kind of an exposure technique. Another thing that I would recommend is to not avoid things entirely. Avoidance maintains, it can heighten anxiety around whatever that thing is that you're avoiding. And be honest about when you're avoiding out of safety precautions versus anxiety issues. You know, consider your reasons for saying no to something. Is it because you're concerned about getting sick and have an underlying condition, or concern about getting ill and not being able to go to work and how that would impact things? Or are you saying no to things because you're concerned about saying the wrong thing to people or not knowing how to interact with others? Those second examples are much more consistent with an anxiety picture and avoidance there, whereas the first examples would represent those cases where you're saying no to things because of safety concerns and precautions that you want to take. Talking to others can be extremely helpful. I think we all have an understanding that people's comfort levels are going to be different. Not everyone's going to be comfortable with this situation, that situation, recognizing that it's going to be up to the individual, and talking to others about it, being open about it, you know, finding out what are you comfortable with? Here's what I'm comfortable with, here's what I'm not, and just being sensitive to that and those differences that people will have. I think getting information about a social event first can be extremely helpful. When does it start? When does it end? How many people are likely to be in attendance? What sort of parameters does that social activity, what sort of parameters are in place? And then, you know, making your decisions based on that. How comfortable would I be with that situation? Getting COVID information from reliable sources, making decisions based on CDC recommendations and community spread and that sort of thing. All of that information can help so that you feel like you're making an informed decision regarding your behaviors and how much social interaction you're going to expose yourself to. One other aspect that I did just want to touch on before wrapping up is in relation to talking to our kids. This can be an extremely confusing sort of situation, you know, especially if you look at an example where like children have been wearing masks everywhere, and it's just what they've been told and they need to do, they've been required to do. And then if there is a shift in that, and if you decide, well, I think in this situation, it's fine to go without a mask, you need to explain that and communicate that and the reasons behind that, so that kids can understand, oh, okay, I've been doing this, but now because of these reasons in this situation, it might be okay. We want to make sure that we're communicating in an age appropriate way with kids so that they're aware of what's behind those decisions, and it helps to ease their anxiety, their fears. And so I think that all of those tips can be utilized and hopefully help to increase that comfort level if you're socializing a bit more and taking those opportunities more.
Thank you, Crystal. We do have a question, I think, building upon, you were touching on kids. I know you work with students. We also have a lot of older adults in our community here in the Upper Peninsula. Your recommendations, do they align also with the older adults? Are there any differences, thinking of maybe anxiety that they might have, you know, getting back out into gatherings in public and other things?
Yeah, I mean, I think it would be safe to assume that in vulnerable populations that have more risk factors, such as older populations, there would likely be more anxiety and fears and stress, just in general. So I think, yeah, you know, you can still utilize some of the tips and approaches, but I do think in general, those vulnerable populations are going to feel much more hesitant and stressed about going into those situations.
And then a follow-up, Crystal, what's the best way to simply check in with somebody about sort of if they have anxiety, what's the best way to approach them without them maybe getting defensive or just being uncomfortable, I guess?
I think being able to acknowledge that, across the board, people are likely going to have some feelings regarding social interaction at this point, after or during or while we're living with, or however you want to phrase that with COVID. I think it's pretty safe to assume that everyone has feelings about it, right? So checking in with somebody in kind of that open-ended way, how are you feeling about this? You don't have to be a therapist to ask somebody that. And so being able to just kind of check in that open-ended way and find out what people are comfortable with disclosing. And it may be the case that people are just not comfortable talking with others about trepidation that they may have or situations that they're just not feeling comfortable taking part in.
We appreciate it, Crystal. We'll, if we have time a little bit, we'll come back with some more questions. We want to keep it moving forward with our next speaker. We're going to welcome in Angela Luskin, who is the manager at the Express Care Clinic right down the street with UP Health System Portage. Angela, good evening. Nice to have you back as well. I know you were on fall of 2020 on our town hall. So if you can tell us a little bit more about your role in the community, and I know you're going to offer some physical activity recommendations for folks. So.
You bet. Yeah, Steve. Hey, thank you for asking me back again. I'm really excited every time I get the opportunity to talk about exercise and moving our body more and being active. So when you asked me, I was, more than happy to say yes. So thank you. And with that today, when I decided kind of what way I wanted to gear this talk, the first thing I made an assumption. Everybody that's tuned in tonight is probably interested in their health, right? They're taking the time to tune in tonight. But why are you interested in your health? I think that's a really important question to ask ourselves, finding the why behind, why we want to be healthier. Do we want to be healthier to feel better? Maybe it's to feel less pain in our bodies. Maybe it's to be a role model for someone that we love. It could even be to reduce chronic diseases. Maybe stress relief is what we're going for, maybe more energy. I think there are a lot of reasons why we want to be healthier. So asking yourself that question, I think, is really important. So finding your why, finding your reason why you want to be healthier. Once we do that, I think that can help motivate us to move more. And moving more, it doesn't have to be complicated. I think a lot of times we overcomplicate it. Really, we just need to move our body more. And walking, I think, is a great place for us to start. And I know we've had an interesting winter week so far, and it's only Thursday. But I really think, we can, if, moving outside in the winter months isn't enjoyable for people, we have great options in our community. We have the Copper Country Mall that gives us, a great option to walk indoors. Also just moving around more in our homes. If we have stairs, going up and down those stairs, moving from my kitchen to my living room, just getting that movement and not sitting as much as we tend to. I do think there are added benefits to getting outside though, and moving our body, especially for that mental health release. And I think that, even living where we are, if we dress appropriately, so wearing the right clothes, wearing the right footwear, we can really get outside and move our bodies throughout the entire year. So I think that is completely possible. How much? How much should we be moving our body? 30 minutes most days of the week is where we'd like to start and aim for. And walking, that was just one simple way, simple idea to move our body more, but there's endless options out there. The other side I want to touch on is strength training. So we really should be incorporating strength training into our weekly routines. And I don't think this has to be complicated as well. You don't need a gym membership to do strength training. We don't need weights at home or other special equipment. Really just using our own body weight will get us far. And I have 5 exercises that I think all of us at home can incorporate without exercise equipment, without weights. So I love push-ups, I love dips for our triceps. Squats are another great one. Bridges for our hips and our glutes area, and then planking for our abdominal area. And what we'd want to do is begin with modified version of each of those 5 exercises and build up from there. So let's take a push-up for an example. So if I haven't been strength training at all, I don't want to get down on the floor and start trying to crank out push-ups. That wouldn't be a great place to start. Instead, what I would do is I'd start with a wall with a good hand position for my hands, and I would do a push-up to the wall. Once that became easier and not much as of a challenge, I would encourage us to move down to the floor, but on our knees, and do a modified push-up on our knees, eventually building up to that full push-up on our toes. And we can do that with each of those different exercises. We'd want a goal of at least 15 minutes of strength training 2 to 3 times a week. So building up to, even with that walking where I said, 30 minutes most days of the week, I don't expect someone that hasn't been exercising regularly to go out and do that, nor would I expect them to start with 3 days a week of strength training. So it is really important to build up to that. I think we have many great resources at our fingertips now. That is one thing that the pandemic has done, I think, is make it easier to find exercises online. And a lot of them are free. We have great virtual exercise classes, including the Up and Moving program through Michigan Tech. There's a lot more that we can do from the comforts of our own home, or just stepping outside in our community. The trails that we have in our community, they're absolutely outstanding. So there are ski, snowshoe, biking, walking trails for most of us within a relatively short distance from our home. So to ensure we move more, we really need to make it a priority. And I have 5 ways to do that, to make exercise a priority. First off, we have to schedule that exercise. We can't go into it without a plan. Really just taking that time to schedule it into your weekly routines will help you to be more successful. Second, removing barriers. So what has kept you from exercising in the past, and how can you overcome those barriers? I would say the number one barrier that I hear from people is time. They don't have the time to exercise. They don't have the time to move their body more. Well, back to that first tip of scheduling it, make it something that we can make an appointment within our week. Schedule it 2-3 times a week and stick to that. Third, you really need to find something that you enjoy. We will never stick to a plan if it's not something that we enjoy doing. And again, back to those endless options of moving our body, find something that you really like to do, and that'll help stick with it. Fourth, making it a habit. So this might be a funny analogy, but most of us, I hope, wouldn't even think twice of not brushing our teeth, right? So exercise really needs to be given that same importance in our life. And brushing our teeth, that's a habit that we do regularly, hopefully daily. And exercise should be given that same magnitude of importance. And then I think the last one, just being kind to ourselves. If we didn't move enough today, you guys, it's okay. Start again tomorrow. Give yourself some grace if you haven't reached the goal you set for yourself. It is okay. Tomorrow's a new day. Let's start fresh. And then I think always trying to remember too that something is always better than nothing. So if I didn't get my 30 minutes in today, it's all right. Maybe I walked around the hospital for lunchtime. Something is definitely better than nothing. So to kind of summarize all of that, I think we all need to find our why. Find your why to why you want to be healthier. Let that motivate you to move more. Second, move your body at least 30 minutes most days of the week. If we can get there, we'll definitely be much more healthier than living a sedentary lifestyle. Incorporating strength training exercises, aiming for 15 minutes, 2 days per week. And then, the fourth, in summary, is just reach out. If you need help, we have an amazing community here. We have great local resources. There are several gyms and studios, fitness instructors, friends, family, myself. I'm happy to help anyone that is maybe struggling to reach their physical activity goals. So, reach out, use those resources.
Well said, Angela. Thank you so much. I know you mentioned some exercises, including walking, using the stairs, strength training. What about snow shoveling? What about yoga? Are there what other forms of movement are out there that if people don't want to lift weights or they don't want to, we all walk, but I think you know where I'm going. What other options do the folks have? If you could elaborate on that just a bit.
You bet. Well, you mentioned the snow shoveling. We've had a lot of that this week. That is great. Strength training as well. Think of gardening, raking, all those things that we can do outdoors really are included in that strength training type of exercises as well. But then there's also those cardiovascular ones. Snowshoeing, biking, swimming is great, especially if maybe we have some hip, knee, back joint issues. Swimming's really good exercise in those cases. I think the key is really trying to find something that you enjoy doing and trying to do that more often.
Thanks, Angela. We're going to bring in next two students from Michigan Tech. We have Isaac Lennox and Carmen Scarfone in the Department of Kinesiology here. And this is a great segue. I think they're going to build upon what Angela talked about, but also take it in a little different direction. So gentlemen, welcome to the program. Turn it over to you.
Thanks, Dr. Elmer and Angela. In addition to staying physically active, it's also important to decrease our time spent sitting. Although sitting time has been increased over the years with TVs enlarging, our phones seem to keep getting bigger too. Our screen time is really exponentially growing, but also throughout the COVID-19 pandemic, our sitting time has increased due to restrictions, quarantine protocols, self-isolation. Some examples of this include social behavioral changes, as well as workplace and environmental changes, education. An example of this would be someone that has worked in a workplace where they may be on their feet a lot, they were active at work, and maybe they had breaks. And now they transition to a remote working, and they're at home, they're seated for most of the day behind a desk, and maybe they don't have as much breaks between their shifts. Likewise, students have gone in and out of the classroom to remote learning at home through virtual platforms. And maybe they're used to having breaks between their courses. They get to walk from one course to another down the hallways, see some friends. That movement is really important. So from here, we think that physical activity is very important. We try to get 30 minutes most days, as Angela mentioned. And also that we try to decrease our time spent sitting, as sitting time is an independent risk factor for heart disease opposed to physical activity only. And really recent evidence suggests that we have decreased our physical activity by about 30% and increased our sitting time by about 30%. So from here, this is important and much concerning because of diseases that may be linked to the physical inactivity or the sitting time, which can lead to obesity, cancer, diabetes, increased blood pressure, and many others.
Thank you, Carmen. So also, when considering how to implement the strategy to decrease our sitting time, we recommend that you break up your sitting time about every 20 to 30 minutes with about 2 to 5 minutes of low movement activity. So for example, to give us all an example that most of us can relate to, the average National Football League football game on TV, it takes up about 3 hours of programming. And along with that, there's about 50 minutes devoted to just commercials. So let's say you decide to get up and get out of your chair during even half of these commercials. Well, what that would what that would equal would be about 25 minutes of low intensity movement that you can still enjoy the action of the game. And all we're doing is getting up and doing some low intensity activities just during a few commercials. So when choosing these activities to break up our sitting time, it's really important to think about our level of enjoyment and engagement with these activities. So the best activities to select are the ones that you can see yourself doing for an extended period of time over days, weeks, and months as they form into habits. If taking a standing break is too boring for you, for example, this plan will be very difficult to follow simply just because you're not that interested in it. So whether it's practicing your golf swing in your living room, playing with your pets, dancing along to your favorite music, these are all activities that interrupt our sitting time, and we also personally enjoy them. So they're probably going to be pretty easy to follow, and then we can form that into some daily living habits that translate over weeks, months, and years.
Thank you, guys. Two questions here for you. I really appreciate this one here. You mentioned the American football games, but we have, I know you both are avid hockey players and from Canada, from Sault Ste. Marie on the Ontario side. So does this apply to an NHL, playoff game coming up, in the spring here?
I'll take a stab at this one, Carmen. Yeah, for sure. You know what? We use the football as an example here, but for sure, any TV program, for example, unless you're watching on Netflix, for example, you're always going to see some commercials. There's always going to be avid amounts of time to get up and to take a break during these TV programs, whether it's a National Hockey League game, if it's in the summer, we're watching baseball, we're watching golf, any sort of TV show, there's always going to be an opportunity to get up, do some sort of light intensity movement that would replace that time spent sitting as well.
Great. And on a more serious note, thank you, guys. Can you just tell us a little bit more? I know the CDC had updated some guidelines last week that are kind of related to what you're talking about. And Angela, could you fill our audience in on those new updates?
Yes, absolutely. So the physical inactivity was listed on the CDC website as a risk factor for severe COVID-19 outcomes. And it's been in the talks for a while about physical activity, but recently has been posted. And it's been something that Exercise is Medicine has been advocating for throughout the public, and really reiterating the importance of getting active 30 minutes most days if you can. If not, maybe starting slow. Any movement is better than no movement. And if you could take a break from seated, like a commercial break, even to grab a drink of water, it all helps.
Great. Thank you, guys. We are just about halfway through our COVID-19 community town hall. I want to pause here just to recognize our sponsors, which include UP Health System Portage and the Michigan Health Endowment Fund. For anybody just joining us, maybe out on 97.7 The Wolf or Q107, we're here for the COVID-19 community town hall. We have a panel of experts here tonight providing information, answering questions. And I want to bring back in our content expert, Kelly Kam, who's an epidemiologist. So Kelly, we're about halfway through. What has stood out so far from your perspective?
Well, I think all of these things, as Isaac and Carmen just mentioned, is that it's physical inactivity, our mental health, tobacco control, nutrition. These are all things that are important not only for COVID and reducing the transmission with COVID, but also the impacts of COVID, but also our top killers in this country. So our top 3 killers are cardiovascular disease, cardiac cancer, and right now COVID is number 3. And so when we look at those, these are all the risk factors for all of those diseases. And so affecting the health behavior changes that we can make for any one of these are going to improve our health overall, not only during the pandemic, but during the rest of the time as well.
Thanks, Kelly. Just I want to remind our listeners and viewers, if you have a question, you can send that in using the Q&A button at the bottom if you're on Zoom, or you can email those to us at townhall2020@mtu.edu. We will keep things moving forward and welcome in our next speaker. We have Karen Brown, who is the Tobacco Dependence Treatment Coordinator with the Michigan Department of Health and Human Services. She's joining us from East Lansing. So Karen, thanks so much for being here. Good evening, and I'll turn it over to you to tell us a little bit more about all things related to tobacco.
Great. I'd like to thank you for inviting me here today to talk about tobacco use. And just wanted to clear up that today I'm going to be talking about commercial tobacco use and not about the traditional tobacco that is used by Native Americans and Alaskan Natives for ceremonial purposes. As just mentioned, the Centers for Disease Control have updated their list of certain medical conditions that put people at higher risk of getting very sick from COVID-19, and it includes current and former cigarette smoking. Despite that, it is never too late to quit and reduce your risk. You can achieve positive cardiac health results in as little as 20 minutes. Two things that tobacco use and COVID have in common are complications in cardiovascular health and respiratory health. If you'd like to see a full list of the health benefits of quitting, I recommend visiting the American Lung Association website at lung.org. During the start of COVID, tobacco treatment services experienced a significant decline in demand both in Michigan and throughout the nation. Cigarette purchases went up for the first time in 20 years in 2020. This might be a result of hoarding since sales rocketed in the first quarter. It may also be an indication of coping mechanisms to deal with stress and uncertainty, as well as increased free time due to being laid off or being sent home to work from home. The indicators that we have so far show that quit attempts in Michigan appear to have leveled out to normal by the fall of 2020, and they remain steady. This may be due to an enhanced paid advertisement campaign that MDHHS ran in the spring and summer of 2020 and 2021, as well as offerings of free nicotine replacement therapy through the Michigan Tobacco Quit Line. Quitting tobacco use or never starting to begin with is one of the best things you can do for your health. And in a time where we all kind of feel a bit out of control, this is something that we might be able to control. The Michigan Department of Health and Human Services has several resources to help people quit. First, for Medicaid patients, is a generous smoking cessation medication benefit. Medicaid covers all 7 FDA-approved medications for quitting, which includes 5 kinds of nicotine replacement therapy and 2 pills that reduce cravings. To get the medication covered, you need a prescription from your healthcare provider. Another is the Michigan Tobacco Quit Line. This is a 24-hour, 7-day-a-week free service that offers Michigan residents coaching services by phone or online to help people quit any form of tobacco or e-cigarettes. We also have a free text to quit service available. The Quit Line works by designing a program that is unique to you. The coaches will talk with you about your past tobacco use history, your craving level, past quit attempts, triggers, medications you might want to try, and concerns about quitting. You may qualify for up to 2 to 8 weeks of free patches, gum, or lozenges. This program can be reached by calling 1-800-784-8669, or you can visit michigan.gov/tobacco. The website also offers information for healthcare providers on how to refer their patients and free continuing education modules on how to talk to patients about quitting. Lastly, the Michigan Department of Community Health and Human Services has a special program for youth and young adults interested in quitting e-cigarettes. Youth can enroll by texting Start My Quit to 36072 or by visiting mylifemyquit.com. And this website also has resources for concerned parents, educators, and youth leaders. So I thank you again for inviting me, and I'm happy to answer questions.
Thank you so much, Karen. We do have a question here. This is actually from Wisconsin. We're here in the Upper Peninsula, our neighbors to the south. Advice for approaching a family member who does use tobacco about some of the resources, seeking out some of the resources you just mentioned. How do you even start the conversation? I think they're getting at here with not, putting them on the spot or making them feel defensive.
I think really first starting out by talking to them about how much you care about them and that you're concerned for them and their health, and you just really wish for them to be healthy. Offer your support for them in going through this difficult transition, and then offer those resources and understand that this is something that really does need to be done in their time. And of course, again, just talking about that concern for them is important. But no, might not be successful the first time. And be supportive of them in that too, and say, I'm here for you when you're ready. And I'm happy to help you make a plan.
Thanks, Karen. I think we're going to have some time here for additional questions, but I want to keep this moving. So next, we're going to welcome in Maria Aguero, who is a clinical dietitian. She's joining us here from the University of Buffalo. So good evening, Maria. Thanks so much for being here. And you're going to help us kind of close the loop and talk a little bit more about diet and nutrition. So take it away. Yep, and we'll just remind Maria to unmute. It happens to the best of us. So if you can go ahead and unmute, we'll be ready to go. There we go. There we go.
Yeah. How are you? Hi, Steve. Thank you for inviting me here today. Yeah, what I want to cover today is about emotional well-being and nutrition, because currently we are living a situation of confinement that generates emotional problems, which can interfere with our emotional well-being. The pandemic and confinement have brought various consequences to our families and daily routines. I can see that a lot in our community. Without a doubt, what has changed the most is the way we eat. Different studies show how a large part of the population was altering food consumption due to the financial stressors or the fear of contracting the virus when going shopping. Also, the pandemic has affected people's physical activity routine. So during the COVID-19 crisis, studies have shown that there has been an increase in the consumption of sugary drinks, snacks high in sugar, more pasta, pizza, sweets, fast food, and pre-cooked products, and a decrease in the consumption of fruit and vegetables and water. And this combination, in the opinion of experts, is very dangerous, especially for those who are overweight or have a chronic disease, such as diabetes or hypertension. So I would like to share with you some tips to help to achieve a healthy lifestyle during the pandemic. The first thing is to plan your diet. Plan your meals ahead of time and make nutritious food choices. It is very important to respect meal times. Try to maintain a balanced diet from all food groups to strengthen your immune system. Balance your plate with a variety of foods. Half your plate should be filled with fruit and vegetables. 1/4 with protein foods like lean meat, poultry, fish, or beans. And 1/4 with grains. To round out your meal, add healthy fats or like avocado, olive oil, or low-fat milk, yogurt, or cheese. If you integrate food from all food groups, you can consume the greatest amount of nutrients. This, together with the performance of physical activity, you will have enough to face this pandemic. Being physically active can help to lower blood pressure, manage stress, and control weight. Be physically active in your own way and start with what you can. Any physical activity is better than none. Be sure to check with your physician before starting any physical program. When it comes to fluid intake, the priority for hydration should always be water, which is cheaper and healthier than sugary drinks. I recommend you go to www.myplay.gov for a plan that will give you the amounts of each food group you need daily. And if you have a special nutrition needs, consult a registered dietitian nutritionist for personalized nutrition advice. And I want to conclude that a balanced diet and physical activity inside your homes are key to maintaining an adequate immune system to face the COVID-19 pandemic and in general, all diseases associated with the winter period.
Great. Thank you so much, Maria. Couple of
Yeah,
questions here for you. You mentioned immune function there at the end. Are there specific foods that you'd recommend that we incorporate in our diet that can help bolster or help with immune function?
Yeah, mostly fruits and vegetables, blueberries, strawberries. Those can help you to boost your immune system, and all type the vegetables really are very good. Broccoli, green beans, yeah, all type of vegetables. And limit sugary drinks and sweets. Those are something as I think Crystal, someone say not to avoid, but limited.
One other question here for you, Maria. We heard from Angela and Isaac and Carmen about, activity going down, sitting going up. I wanted to ask, is that associated with weight gain during the pandemic? And if so, do you have any suggestions for if there are people, trying to get back to a healthier body weight?
Yeah, so I can see that a lot, and especially in children. So the growth chart, you can see like that, instead going like this, it's that is very significant. So children can weigh, some children 40 pounds in 1 year. So what I recommend always is try to do some physical activity and portioning. So that is very important. So watch your portion sizes. Enjoy your food, but it's important to watch the portion sizes, and they need to learn about especially foods high in carbohydrates. They can eat it, rice, pasta, but it's important to know the portion size.
Thanks, Maria. I want to bring back Kelly in here. We made it through all of our speakers here. Kelly, we have about 10 minutes. I know there's a few more questions. I'm going to go to the next one. And then after that, if you can help me just check the Q&A button in our email and see if anything comes up. And I think we'll be able to have a nice little discussion here to round out. So sound good, Kelly?
Sounds good to me.
Okay. Next question, we're going to start here with Crystal. Thinking about some of the longer lasting effects of the pandemic on our mental health. Kelly framed it that things are looking better and we're looking to really build forward from the pandemic, but how long do you think we'll be dealing with some of these longer lasting effects?
Yeah, that's kind of a tough question. We don't have a whole ton of longitudinal data at this point. But I do think it depends on the experiences that people have had with COVID. When you think about those who have lost loved ones, that's multiple people who are going to be experiencing and dealing with grief and loss. And, that's a pretty significant sort of emotional mental health issue that some people, unfortunately, are going to be dealing with for a while. Essential workers, I think we've all been familiar with some of the exhaustion and stress and burnout, PTSD type symptoms. And just how long will that last? Oftentimes that is based on the individual. I think certain other groups like Generation Z teens and young adults, they do report the highest stress levels compared to other groups. And they have experienced pretty significant losses, delays in certain milestones, looking at things like going away to school or getting jobs or having opportunities like internships and co-ops and those sorts of things. Some of those have been delayed or just absent. And looking at those impacts and dealing with some of that. We've already talked about the anxiety piece. I think that people are pretty resilient and people will adjust, but it could be a gradual, slow process. And so essentially, I think it depends on the experiences that people have had with COVID. And I think it depends a lot on the particular groups and some of those shared experiences. And then just individually, you know, how people recover, how they get through things, that's going to vary.
Thanks, Crystal. Kelly, I'm going to check in with you. What do we got for our next question?
Well, I have a question for Karen here. So speaking of, as Crystal was saying, so our teenagers are really experiencing quite disruptions and have been experiencing these disruptions. And you mentioned that tobacco use can be a coping mechanism. And so as the children and the teenagers are kind of maybe we're not seeing them as much now because schools are back in session and they're doing more activities. What, as a parent, would we want to be looking out for in terms of checking in with our kids if they are using tobacco or vaping, so that we can stop them and, you know, early on, and we don't get that start, you know, as you said, to stop before we start kind of issue?
I think checking in with them is really important. Talking about some of the temptations that go, particularly with e-cigarettes or vaping. You might hear them, you know, call it vaping too. With all the different flavors that are out there that are so appealing to youth. Really talking about, you know, what that can do to them, either in the short term, which kids are really most interested in hearing, is what's going to happen to them in the short term. And in the short term, we're seeing things like shortness of breath, poor performance in sports, you know, when they previously were doing much better, inattentiveness in school, having a hard time focusing. All these things could be some signs that they're starting to or getting involved in using e-cigarettes, and that's starting to have an effect on them. So having those conversations, looking out for those key things are definitely important. Going to that My Life, My Quit website is helpful too, because there are a lot of resources on there that don't necessarily have to do with quitting. There are educational resources on there as well, and that you as a parent and your child can go through some of the educational things together and learn more about e-cigarettes. So that's always available. So I encourage people to pull that up and use some of those resources.
Looks like, thank you, Kelly, and thanks, Karen. Next question is for Angela. Maria did a great job highlighting and giving us some great advice from diet nutrition. Here locally, if folks need some counseling or they need some help, what resources are right here available in the Copper Country?
That's a great question. We do have registered dietitians at UP Health System Portage. I'm pretty confident that Aspirus has registered dietitians on staff as well. So, you know, those are two great local resources. Talking to your primary care physician is another great place to start. They often can do a referral to a registered dietitian if that's needed from an insurance standpoint. So those are, I think, some great local resources that we have at our fingertips.
We're going to move over to Isaac and Carmen. There's a question here. I think Angela had mentioned it, kind of connecting the dots here about this Up and Moving program. And I know you guys have put together a lunchtime video for working adults or kids. Can you just tell us real quickly what that's about and where can people find this video?
Yeah, for sure. I can take a stab at it if you like, Carmen, so we don't cut each other off here. But yeah, with our Up and Moving team, throughout since the start of the pandemic and when Up and Moving was created, there's been a lot of graduate students, undergrad students, community members that have jumped in to help out with the program to increase physical activity around the community. We did a few lunchtime videos that you can be found on upandmoving.org. They consist of sort of like a Hollywood Squares, sort of just as we're viewing here on our webinar. We bounce around from student to student. We're selecting some exercises that can be completed at home using minimal equipment. And we're really just trying to get that out there to make it more accessible. It can be found on DVD as well. Upandmoving.org. We have our Facebook page for where videos are also posted on Facebook Live. And then we have our YouTube channel as well, which can be located through typing in Up and Moving on your web browser.
And Carmen, if we can just involve you here, the lunchtime video, what type of movements or exercises did you have people doing right from their desk or at home?
Yeah, so these are sort of like an exercise snack. So we're doing little movements that you could do if you're in dress clothes, if you're on your lunch break, if you're working from your desk. So we're doing some exercises to help with some posture of sitting with our shoulders rounded. So trying to open up our chest and doing some cross body stretches with our arms, maybe our shoulders feel a little bit better. And it really just getting out of our chair and standing upright and just moving our legs a little bit. And we're just trying to increase our time moving.
Thank you, guys. What we're going to do next, and again, upandmoving.org is the website that you mentioned. I'd like to give each speaker just a few seconds here, maybe 10 or 15 seconds, if you can just give us kind of a take-home message for our viewers and listeners tonight. Kelly, we'll end with you. So I thought we'd start with Maria. So from a nutritional perspective, what's the take-home message that you'd like folks to leave with tonight?
Try to set healthy, realistic goals. As I mentioned, try to eat a balanced diet from all food groups. Try not to be, to put in your mind like you have to avoid some food that you like it, but try to limit it.
Thank you so much, Maria. Let's go to Crystal next.
I just want to remind people to be patient and to be understanding of one another. This is a shared experience that has been extremely impactful on everyone. And just kind of recognizing that people are going to have individual comfort levels with different aspects related to COVID. And so just trying to be as understanding about that as possible.
Great. Let's go to Karen next. Karen, go ahead.
Sure. I think really, if you are currently using tobacco, including e-cigarettes, I know this is a really stressful time to be thinking about making a big behavior change like quitting, but there are all kinds of resources out there to get you help, whether that's talking to your doctor or one of the sites that I mentioned earlier. If you do nothing else, then just click on some of those sites and get thinking about it. That's great, and it's a good start to improving your health and having lifelong good health.
Thanks, Karen. Let's go to Angela, and then we'll wrap up with Isaac and Carmen.
On the physical activity side, I really don't want to oversimplify it, but it really comes down to moving more. We really just need to move our bodies more, find something that you enjoy to do, and move more.
Okay. And Isaac and Carmen, I think I know what you're going to say, so take it away.
Yeah, along with moving more, think about it next time if you're watching a TV program for an extended period of time, or even for a 30-minute, half-hour special. When that commercial break comes on, potentially think about getting up, whether it's to go to the sink, to go to the fridge and grab a glass of water, for example. Anything, any small dose of movement is a great start towards a healthy lifestyle.
Okay. Thank you both. And Kelly, I'll give you the final word here, about 10 seconds, and then I better wrap up. I got radio telling me to end in about 30 seconds.
Absolutely. So all of these things can keep you healthy, and they can also keep our society healthy. So do what you can to protect yourself and your neighbors.
Thank you to all of our speakers and our listeners tonight, to UP Health System Portage, the Michigan Health Endowment Fund. We appreciate the support. Our next town hall will be the final Thursday in March. And remember, if anybody couldn't make it tonight, they can watch the rebroadcast on Sunday at 12 p.m. Eastern. Have a good evening, everyone. We'll see you next month.
Bye.